Hello, today we're going to be talking about stimulant use disorder. Cocaine is a commonly abused stimulant. Stimulants are used to increase alertness and are known to elevate blood pressure as well as heart rate. The Diagnostic and Statistical Manual of Mental Disorders, otherwise known as the DSM-5, classifies stimulant use disorder as a substance use disorder. According to the DSM-5's diagnostic criteria, the patient must meet at least 2 of the 11 criteria for the diagnosis to be met. A patient meeting 2 to 3 of the criteria indicates mild substance use disorder, while a patient meeting 4 to 5 criteria indicates moderate substance use disorder. And last, a patient meeting 6 to 7 indicates severe substance use disorder. The diagnostic criteria reads as follows. Number 1, continuing to use cocaine despite negative personal consequences. Number 2, repeatedly unable to carry out major obligations at work, school, or home due to substance use. Number 3, recurrent use of substance in physically hazardous situations. Number 4, continued use despite persistent or recurring social or interpersonal problems caused or made worse by substance use. Number 5, tolerance as defined by either a need for markedly increasing amounts to achieve intoxication or desired effects or markedly diminished effects with continued use of the same amount. Number 6, withdrawing manifesting as either a characteristic syndrome or the substance is used to avoid withdrawal. Number 7, using greater amounts or using over a longer time period than intended. Number 8, persistent desire or unsuccessful efforts to cut down or control cocaine use. Number 8, spending a lot of time obtaining, using, or recovering from using the substance. Number 9, stopping or reducing important social, occupational, or recreational activities due to cocaine use. Number 10, consistent use of the substance despite acknowledgement of persistent or recurrent physical or psychological difficulties from using the substance. And number 11, craving or a strong desire to use cocaine. As we just read the list of diagnostic criteria for substance use disorder, we now know that the diagnosis is based off of the DSM-5. Laboratory and imaging tests may also be done to confirm diagnosis. Some of these include urine toxicology screen, an electrocardiography level test, HIV testing, EEG testing, computed tomography scan of the brain, as well as the MRI scan of the brain. Now let's talk about the identified causes of substance use disorder, in this case, cocaine. Addiction is linked to biomechanical changes in the mesolimbic dopamine system of the brain. The use of cocaine causes heightened sensations due to changes in the mesolimbic dopamine system. Susceptibility to cocaine use then increases and allows for mechanism of withdrawal. There are a few categories of predisposing factors which make one susceptible to cocaine use. For one, let's talk about drug factors in itself. Availability and controls on drug use have an impact on who gets a hold of it. The drug's ability to produce dependence, tolerance, and euphoria, again, make it addicting, as we mentioned when we discussed the mesolimbic dopamine system. Environmental factors is another, such as where one lives, which relates to poverty and maybe even unemployment. Additional predisposing factors which make one susceptible to cocaine use include psychiatric illness, such as depression or schizophrenia, psychological and psychosocial factors involving addictive behaviors and the need to relieve anxiety. Additional predisposing factors are a vulnerable personality, peer pressure, in addition to age. To elaborate a little bit more on age, teens and those in their 20s are more likely to be cocaine users. Gender is an additional predisposing factor. Males are more likely to use cocaine than females. Cocaine use affects both the body and the brain. The central nervous system and psychiatric symptoms that come along with cocaine use include euphoria, increased energy, excitement and sociability, reduced hunger, fatigue, emotional instability, restlessness, irritability, apprehension, cold sweats, tremors, hallucinations, dilated pupils, vomiting, headaches, as well as vertigo. Common cardiovascular symptoms that come along with cocaine use include the risk of a myocardial ischemia as well as the risk of a myocardial infarction. Heart rate is affected by tachycardia and angina, and blood pressure is affected by vasoconstriction and hypertension. Cocaine withdrawal is a severe symptom caused by psychological and biochemical dependency on cocaine. Dopamine deficiency in the central nervous system caused by abstinence after using cocaine for a long period of time causes cocaine withdrawal. Clinical manifestations of cocaine withdrawal include depression, fatigue, irritability, insomnia, psychomotor agitation, as well as craving more cocaine. Psychomotor agitation would have an effect on occupational performance. Medical treatment is available to those affected by substance use disorder. Medical treatment entails encouraging the patient into a treatment program in order to reduce harm associated with drug use. It also entails treating physical complications of drug use and the interactions with prescription drugs such as benzodiazepines and phentolamine. The possibility of misuse of these prescription drugs is also reduced thanks to medical treatment. Of course, general medical care is offered, and the patient, like mentioned earlier, may be referred to an appropriate treatment center or program that may or may not include cognitive behavioral therapy as well as lifestyle changes. Client factors that are associated with substance use disorder include the client's readiness to commit to treatment. Social support experienced by the clients is also really important when it comes to their recovery. Motivation to recover is crucial. Motivation to recover involves amounts of self-determination as well as self-efficacy. Cocaine may have an impact on one's occupational performance. Low levels of volition are common in cocaine users. Cocaine users are not able to see themselves as capable of having the skills that they need to be fully independent. So therefore, drive is affected. In addition, they have problems with anger control and the ability to control their anger in order to successfully complete tasks without agitation. Hence, once again, occupational performance is affected. There is a direct effect on the instrumental activities of daily living in some cocaine users. Financial independence, for example, is common, and caring for others becomes a difficulty. Another area of occupation that is affected is leisure. Cocaine users view the using of cocaine as a leisure activity. Therefore, occupational therapists must aid in helping clients find a healthy leisure activity to participate in.